Yeah, so today I'll be presenting Natco Pharma, and it is a vertically integrated research and development focused pharmaceutical company. Their mission is making specialty medicines accessible to all. So, Natco Pharma was incorporated in 1981 as a private limited company. They began commercial operations in 1984 to manufacture life-saving drugs. And in 1994, it was converted into a public limited company. It was founded by Mr. VC Nannapaneni. He is a technocrat who turned into an entrepreneur. It is, and Natco is engaged in developing, manufacturing, and marketing APIs and finished dosage formulations. Their first ever product was Cardicap, an anti-anginal drug. They introduced many products in the market, namely Coldat, Feronat, Isosorbide, and Theophylline. By 1985, they had dosage forms in cardiovascular, anti-cold, anti-asthmatic, and antibiotic segments. The same year, they also pioneered the time-release technology in India for the dosage forms of life-saving drugs. In the formulation segment, Natco is a leading player in the oncology domain and a preferred supplier to many MNCs in the pharmaceutical industry. One noteworthy feature of Natco is that their research was that it could develop life-saving drugs at an affordable cost for patients. For instance, before Natco introduced one of their products called Veenat for curing chronic myeloid leukemia. The cost for a month's dosage was approximately rupees 1,20,000 in the Indian market. As a result of Natco's research efforts, they were able to introduce their product Veenath at the drastically reduced price of rupees 6,000 only. That is a big difference. So similarly, in 2012, they also won they won the first ever compulsory license to market Bayer's product Nexavar, which is used for curing kidney cancer, at a low cost of rupees 8,880 for a monthly dose of 120 tablets, compared to Bayer's price, which was originally 2,84,428 rupees. So, yeah. Sorry about the font. Actually, I lost the source format in which I made this. So I had to just take a picture of it and paste it. But so 1981 they were incorporated, and then in 1988 they inaugurated their first parenterals manufacturing facility in Telangana. In 1993 they opened up their chemical division, and 1995 they opened their organics division, and 2003 they launched one of their current key segments, that is oncology car division, with their flagship brand, that is Venus, which I just mentioned, for chronic leukemia. And 2007 they got their first ANDA in the US, and in 2008 they got their first Para 4 certification in the US. In 2012, they got the first ever compulsory license ever granted in India for a patent protected drug. And in 2016, they launched G Tamiflu, which was a big addition to their revenue since then. And in 2019, they forayed into agrichemicals with all the background that they had. In 2021, Revlimid, they announced the launch of it, which is one of their key growth drivers now. And in 2022, they signed an agreement with Medicines Patent Pool Switzerland. These are like the key main events that I could highlight. Next, we'll talk about their business segments. So, firstly, formulations, they are domestic and international. So, domestic formulations, what it is that it is largely concentrated across three therapeutic areas of oncology, cardiology, and diabetology, and specialty pharmaceuticals as well. So in domestics, their primary focus has been on the high value and less competitive oncology, matlab cancer related products, wherein the company has a history of challenging innovators' patents to launch generic versions of oncology drugs at an affordable price, like Veenath, for example, which I mentioned in the intro itself. So they are the leader in the domestic oncology space with a 20% market share. This segment is still very underutilized, and they expect the division to grow in the years to come. So they are also increasing their sales force for coverage in the cardiology and the diabetology division, which is expected to diversify their whole profile. So, and next they also do international formulation export. So they have a strong presence in the US. US is their key market basically, and they have carved out a niche for themselves by using their unique product range. And then they're also they have a collaboration based approach. So they focus on products with high barriers to entry, and the ones with very complex and difficult chemistries and production processes, and also novel drug delivery methods. So they partner with global pharmaceutical players to market products which have very limited competition opportunity. And these partnerships, yeah, so the partners basically handle the front end marketing litigation challenges in the US. They take the responsibility of lengthy and complex litigation processes, regulatory issues, and also securing the ANDA approval as well. This enables the company to focus on only their key activity of research and manufacturing. So yeah, so what they focus is on para 4 and first to file molecules, which we'll get into later. But let's move on to the next segment, which is API. So they manufacture API as well for sales in the domestic and international markets, apart from captive consumption. So this is somewhat some kind of backward integration that they do. They have a robust presence in the API segment, and they focus on the manufacturing of niche molecules to supplement their formulations business itself. So currently, there are 44 active drug master files in the US with niche products under development. Next, they have their subsidiaries as well, international subsidiaries. So they have 8 subsidiaries, including 2 step-down subsidiaries. They distribute their products through their subsidiaries in Brazil, Canada, Australia, Singapore, and Philippines in foreign markets where their subsidiaries are located, basically. So they have a strong portfolio of products in Canada covering oncology, cardiovascular, and CNS therapies. In Brazil, they have high potential generic products. Then, they have been able to build their presence in Singapore as well with tender and private segments through branded generics, and also has obtained 10 plus product approvals already. So they have also received their first approval in China and Philippines, and they are engaging new partners for certain products. So this is how they do their sales and distribution in the US as well through their subsidiaries. Subsidiaries called Dash Pharmaceuticals. So crop, okay, so this was meant to be called agrochemicals. So the management, so what they knew was that their chemistry is a strong subject, and that it would be sensible for them to enter the agrochemical sector with that background. So the Crop Health Sciences Division, as they call it, CHS, it is established under the agrochemical segment. On the crop health sciences front, they launched the first indigenously manufactured pheromone-based product in India for controlling pink bollworm, which is a worm that affects the cotton crop. So they are looking to enter into the domestic agrochemical space with the same strategy that they use for the others. So they are looking to be the first generic player for CTPR. CTPR is basically a technical ingredient that is used in pest management or insecticides. So these are currently patented products of the CTPR products are currently patented products of FMC Corporation, which is a large American MNC. So they have already received approval for these products, and they were also facing patent litigations in courts, which have been solved now. And second product that Natco is looking to launch in this segment is the first of its kind product in India for, again, cotton crops, the technology for which it has in-licensed from an Indian company itself. So if we talk about their business, product-wise split, majority of the revenue, if you see, it comes from formulations segment itself, and around 8% comes from the API. This is as of quarter 4 of FY23, by the way. And others, mane all the agrochemicals and other businesses that they have. So, but major revenue comes from the formulations, that is complex generics, etc. So that, and again, in that major revenue comes from US exports. So segment-wise breakup, if we see, pharmaceuticals is obviously their major segment. Around 97% is revenue comes from pharmaceuticals. Only around 3% comes from agrochemicals. So agrochemicals is something that they have just started with, and they will be ramping up the business soon in the coming years. So, but yeah, the main business is obviously pharmaceuticals. Location-wise breakup, these figures are as of FY 2022. So you can see that major revenue that comes is from the US, around 51.35%, and from domestic, it's around 31.65%. Rest of the world is like UK, then Philippines, Asian markets, वगैरह. From there, around 17% as of FY 2022. So yeah, let's talk about the most important part. That is their business model. That is what differentiates them from other pharma companies. So the generic drugs business has become highly competitive globally, as there are a large number of players targeting the same opportunities, and also this results in lower profitability for someone new that wants to enter. So their business model from the very beginning has been to avoid participating in such highly competitive areas itself. So one of the primary ways to accomplish this is to challenge an innovator's drug patent. So in the US market, there is a proper process through which generic pharma companies can do exactly this. So yeah, so challenging innovator drugs in the US, for any pharma company to launch a generic version of a drug, it has to file an application with the FDA, that is the Food and Drug Administrator, called as NDA, that we know about, abbreviated new drug application. So there are multiple types of ANDAs. I'll talk about para 2, para 3, and para 4. So para 2, a para 2 filing is made when a drug is already off patent. Para 3 filing is made when the generic company has no plans to sell the drug until the innovator drug is off patent. Para 4 filing is made by a generic company when it believes that its product does not infringe on the innovator's patents, or it believes that the innovator's patents are not valid or enforceable. So this is what Natco does. So I've tried to put the para 4 or FTF business model into a 5-step process to try and make it simpler to explain. So here we go. So step one in is the generic drug application, the ANDA. So a pharmaceutical company, say, is interested in producing a generic version of a branded drug. They submit an abbreviated new drug application, ANDA, to the FDA, and the ANDA demonstrates that the generic drug is equivalent to the branded drug in terms of safety, efficacy, and quality. So this is the first step that they have to pass. And then second is the para 4 certification. So within the ANDA filing, the generic drug manufacturer includes a paragraph 4. Para 4 is paragraph 4 certification. The certification asserts that the patents listed for the branded drug are either invalid or will not be infringed upon by the generic product. By submitting this certification, that is a para 4 certification, the generic company challenges the validity of the patents that are protecting the branded drug of the innovator. Sorry, just a second. I'm going to mute my phone. Yeah. So the step three is patent litigation. So upon receiving the para 4 certification, the branded drug manufacturer may, that is the innovator, they may choose to take legal action against the generic company. So patent litigation ensues that two companies battle over the validity of the patents in question. So the next step is basically first to file FTF, exclusivity. So if the generic company successfully wins the patent litigation and gains FDA approval for its generic drug, it becomes the first to file, that is FTF. As a reward for being the first generic company to challenge the patent and win approval, they receive a period of exclusivity, during which other generic manufacturers are blocked from obtaining the FDA approval for their versions of the same drug. So this is somewhat like a first mover advantage. So the last step is market advantage, and this is not a step, but this is what these are like the fruits that they reap afterwards. So market advantage and competition. So during the FTF, that is the first to file exclusivity period, the winning generic company enjoys a competitive advantage in the market. It becomes the sole supplier of the generic drug, which can result in higher sales and profits. Once the exclusivity period ends, the other generic manufacturers can enter the market with their versions of the drug, leading to increased competition and then obviously lower prices for consumers as well. So to simplify, after all this has happened, the innovator basically, after a paraphore has been filed, they have 45 days to challenge or sue the generic company for for its patents. So if the innovator decides to do this, then the FDA holds the generic approval for 30 months or till the patent litigation. So this is one also a key risk in this business model, let's say. So based on the outcome of such a patent case, either by court or mutual settlement, the FDA then approves or disapproves the NDA. So the main point is that the first generic company that makes a para 4 filing and clears the patent litigation gets 180 days exclusivity. So this is called the first to file exclusivity. So this exclusivity makes sure that they are the first company to market the generic version of the drug before everyone else, and thus they are able to basically get a larger market share, garner a larger market share. So to understand it, let's see the first ever case in India in which a compulsory license was granted to Natco. So Natco versus Bayer. So what happened here was Bayer Corporation. This is a landmark case in the history of the long-standing disputes over compulsory licensing in the pharmaceutical sector of India. So compulsory licensing is basically it is considered to be the grant of a license to a third party for a patented drug by the government without the consent of the patentee. So the reason for the dispute between Natco and Bayer was a drug named Nexavar. The molecule name was sorafenib tosylate, but okay, that doesn't matter. But which is used to basically treat kidney cancer. So Natco Pharma had filed an appeal for the grant of compulsory license for the drug Nexavar of Bio Corporation before the Intellectual Property Board. And after a long range of disputes at the end, India's first ever compulsory license was granted to Natco Pharma. So Natco was directed by the board to sell the patented drug, thereby paying a royalty at 6% of its net sales to of the patented drug under its brand name to Bayer basically. The drug was allowed to be sold at a price of 8,800. So if you remember, I had mentioned that originally for 120 tablets for a month-long dosage, Bayer was charging 2 lakh rupees plus, but they had successfully brought it down to a low price of rupees 8,800. That also goes with their vision. So yeah, so let's quickly go through the timeline of this. So firstly, Nexavar was invented by Bayer Corporation. Then they made a patent application in the United States. Then in 2000, they filed a PCT, Patent Cooperation Treaty. That means basically you can seek patent protection for any invention simultaneously in each of a large number of countries by filing an international patent application. So then in 2005, they launched the drug Gleevec and was selling it under the name Nexavar. And in 2008, the patent was granted to Gleevec in India to Bayer. In 2010, the generic version was being sold by Cipla. And in 2011 was when Natco applied for a compulsory license to manufacture and sell a generic version of Nexavar. And in 2012, they were successfully granted the first compulsory license. Yeah. Okay, so this is the key para for so this is
Shantanu,
yeah,
sorry, one question. So Cipla already was having the generic, is it, before Natco came in?
mm,
In 2010,
yeah,
it says that generic version of the drug was being sold by another manufacturer, Cipla.
yeah.
So what's the difference then? Like Cipla already was making the generic, but how is that possible? Because Bayer was holding the patent, so they generally don't allow generics in that period, no?
They don't, but I think they might have had some sort of agreement with Bayer. I can get back to
Okay.
you with this.
Yeah, if possible, just let us know because
Because for other ones also I'd seen, even though
mm,
Natco had challenged in the Para 4 certification thing,
yeah.
some other companies already had an agreement with the innovator drug and they were
Okay.
already selling it. So it is
Okay.
possible. I'll check and get back.
Okay. All right.
Yeah. So yeah, so this whole Para 4 thing is their main business model, and that is the differentiated strategy, I'd say. So as of now, so this key Para 4 pipeline that they have, this is kind of a medium-term trigger in itself. So as of now, they have 19 Para 4s in their pipeline, out of which 11 are approved. Approved as in they are subject to litigation as well. Not fully approved, I'd say. But the main thing is that this business model is not very risky for them because they partner with global pharmaceutical players, and they become their marketing partner, and they become responsible for any litigation and regulatory processes. So these people can solely focus on the research itself. So this is actually in their latest investor presentation. They had mentioned they had given the pipeline of the key para 4 molecules that they are aiming at to launch in the coming years, and some information are picked from Value Picker, like the status or launch possibility, and their partner and the innovator. Because Natco, I could not find that information anywhere in the annual report and such. So, for example, if we talk about say Linparza, or molecule name is olaparib. Yeah, so their innovator is AstraZeneca and Merck. AstraZeneca is a British Swedish multinational pharmaceutical, as we know. Merck is also again an American MNC. So uh, this one is used for ovarian or breast cancer. And Natco's partner is again of another pharmaceutical company called Alembic. So the status we can see, we talked about first to file. Natco is the first to file the Para 4 certification for this, and they have got the necessary approvals, and they are expecting to launch it in 2031. So I mean, there's time, but these I'd say these Para 4 products, I mean the ones they are aiming for, will continue to generate revenue for their business in the coming years, like the ones that have already, which I'll talk about. But again, even this one key brand called Ozempic or semaglutide pen. So it is like a pen. It is an injectable. It is used to control high blood sugar people with type 2 diabetes. It has a US revenue of 5 billion USD plus for FY22, as in global sales. So, but the innovator is Novo Nordisk, and there's no competitors again like Natco. They like to enter areas where there's no high competition. That's their whole business model again. So this Novo Nordisk, they have a monopoly position in the semaglutide family of drugs like Ozempic. So here they are partnered with Milan. It is a global generic and specialty pharmaceuticals company. It's now called Viatris, as in they were acquired, I think. And yeah, again, here also they have a FTF. So this is how they plan to kind of secure their future growth drivers. And yeah, so moving on to the previous successes of their strategy, this business model. So as we know, they focus on complex generics with minimal competition, and they identify large complex generic drugs and challenge the innovator companies basically. So I'll mention a few successful launches that worked out pretty well for Natco. One is Copaxone. So Copaxone, as in generic version of Copaxone. So it is a prescription medicine that is used to treat relapsing forms of multiple sclerosis. It is so what happened here was the market opportunity for Copaxone was at like USD $4 billion. Despite entering the market as the second player, Natco still managed to capture over 35% of the market share. So the first entrant was Sandoz with a 20 milligram variant, and even though they had other players, Natco has not faced further competition even after the innovator lost a litigation case a few years ago. And still, Copaxone is the top eight products that contribute majorly to the US revenues. And another one was G-phosphorinol. Phosphorinol is used to lower phosphate levels in patients with end stage kidney diseases. The innovator of phosphorinol experienced regulatory issues and was banned at one point. So initially there were 12 generic manufacturers, but the numbers reduced significantly, leaving only two remaining in the market. So most of the cases, what happens in this sector is that not only one way is that they challenge the patent, but sometimes because of their not because sometimes they're not able to keep up with the quality, and most of the manufacturers kind of drop products, and then there's again less competition in the market. So Doxil is used to treat certain types of cancer, such as ovarian cancer, AIDS-related issues, then multiple myeloma. It works by slowing or stopping the cancer cell growth, basically. So they are again here. The drug delivery mechanism was very challenging. So Natco focuses, as we know, on complex chemistries and processes. So Natco is the second company to launch Doxil after Sun Pharma, but yet they managed to gain 40% market share within the first year. So like I said, they suffered due to quality issues. Sun Pharma's market share suffered due to quality issues itself. So these are just three of the launches, but I'd say currently they have another five of such products that they entered through Para 4 certification. Para 4, as in challenging the innovator drug, but now they are key contributors to their revenue itself. So yeah, board of
Shantanu, one question: is Revlimid also para 4 or it's not?
it is.
It is para 4. Okay,
Yeah,
and that
Revlimid is.
that is expected to be one of their biggest successes, no?
Yes,
Okay,
I'll get into that actually.
sure,
It's one of my growth triggers. So,
sure.
so board of directors, again, I'll leave it to reading, but as regard to the forensic check, the everyone on the board has relevant experience, and everyone's position is justified, I'd say. So,
Who is the founder, Shantanu? This guy?
yeah,
Yeah,
yeah, yeah.
just tell us a little about the founder.
Yeah, sure. So the founder is Mr. VC Nannapaneni. He's a postgraduate in pharmacy from Andhra University. He has over 40 years of experience in pharmaceutical industry. He also holds a master's degree in pharmaceutical administration from the Brooklyn College of Pharmacy, USA. So after working in US for lots of various pharmaceutical companies, he returned to India in 1981. So he founded Natco in 1981 with a small loan of rupees 33 lakh that he managed to secure with support from his family itself. And as of today, he's the 10th richest person in Hyderabad. So he's the one who has founded the company, but now his son, Mr. Rajiv Nannapaneni, he mainly runs the company. Although, yeah, he mainly handles the new projects, वगैरह, everything. So, promoters, if I had to say, then Mr. VC Rannapaneni and Mr. Rajiv Rannapaneni are the two main promoters of the company. And even in the con calls, you'll find only Mr. Rajiv Nannapaneni answering all the questions, वगैरह. Mr. VC Nannapaneni does not partake fully, but rather he's the one who founded the company, and he has grown it to where it is now, I'd say. So the shareholding pattern, the promoter group holds less than 50% and around 50%, and DIIs hold around 15%, and FIIs hold around 11%. Public holds around 24%. So promoter holdings, the Nannapaneni family and their relatives mainly hold majority of the promoter holding, and rest is also actually held by them through various other companies in which they are the owners, or family trusts that they have. And then DII holdings are all these mutual fund companies like LIC, ICICI, Mirai, Quant, Tata, SBI, etc. And then FII holdings have all foreign asset management and investment firms like Nomura, Singapore, or Vanguard, BlackRock. So The promoters have not pledged any of their shares. The pledged shares are at 0%. And one more thing was recently in the latest shareholding pattern that was released in June 2023. So a value investor, Mr. Akash Banchali, he had purchased 18 lakh plus shares with at a stake of 1.01%. So forensics analysis, I'd say this is one of the few companies that gets a slightly higher score, and there was nothing fishy about it or nothing concerning. Rather, I didn't even find anything to mark as further investigation required. So they checked out 20 out of 23 checks, and their overall score was 87%. Only three things was: one was their promoter skin in the game, which is less than 50%. This should be 49.76%. Sorry. So yeah, so this is okay because all of their family's net worth is invested in the company, and they're not into other diversified fields or something. They're all I mean, they are focused on the pharma and on Natco Pharma mainly. So they pay rent to Mr. VC Nannapaneni and Mr. Rajiv Nannapaneni around rupees 60 lakhs, but the RPT to sales ratio is at 1.25%, which is very low. So again, not very concerning. And other expenses as well, they spend more than 15%, that is 18.4%. But if you take the other companies as such as its peers in this sector, then majority of the companies spend more than 15%. So nothing concerning again. So let's move on to the key metrics. So
Shantanu,
yeah,
one question. I don't know if you'll cover it later. Do you have their percentage of R&D spent to revenue?
yeah, I do.
Okay,
Yeah.
great.
So, uh, huh. so, business value generation. Firstly, let's talk about the revenue and gross margins. So, actually, I should have what I've realized is I should have included FY12 and FY13 because, but I'll give you the figure. In FY12, 2012, their revenues range around 500 to 600 crores, and same in FY13 to around 600, 700 crores. So the pattern kind of has been like for a prolonged period, they'll see like only a stagnant growth, slow moving growth. And then suddenly they'll have a key growth driver, something like Revlimid or Tamiflu or Copaxone. And then they'll see a exponential growth. Like in this period from FY15, if we see, there was a 200 crore jump to 1000 crores, 1050 crores almost. And then in FY17, there was almost 100% revenue growth to 2020 crores. So, so for the next 3 years, they have kind of been in that range. And here, what happened was in FY19, there was a sharp decline in their Tamiflu sales. So because of intense competition, and also this led to a shrinkage in their market share in the hepatitis segment. So what happened was there was a slight degrowth, which could have been worse, but at the same time they had launched Copaxone, so that kind of cushioned the degrowth. So in FY19, 20, and 21, the sharp reduction in Tamiflu, it was cushioned by the Copaxone sales. So and then like what I mentioned was that exponential growth after stagnant growth, that same pattern you can kind of see in FY22 to FY23. So if you see all these years, 3, 4, 6 years, there was stagnant growth, and then as of FY23, wherein Revlimid came in, so almost around 700 around 700 crores of increase in the revenue, and there was a exponential growth, and this is what is supposed to continue. So if we so in 9 month FY 2023, they saw a revenue growth of 37.4%. This was mainly because of Revlimid and also the performance from their Canada and Brazilian subsidiaries. Again, you can see the same thing with the ROE, ROC also. Uh, this I think the in FY22 ROE, ROC fell because they also did write-offs वगैरह, and in FY23 we can see it's kind of growing back to 15, 18%. So the whole thing is that there will be a prolonged period of stagnant growth in this company, and then suddenly there will be some key growth driver, and then there'll be exponential growth. So if we see their EBITDA and PAT in FY22, what happened was there was a big write-off that they did in Q4 of FY22 of 232 crores, and also provisioning losses of 46 crores, because of which both their EBITDA and PAT numbers are suppressed, and that's why you can see a weird fall after all these years of kind of being above 500 crores. And then in FY23, there's again continued growth. So FY22 is not the right word I'm using, but kind of ignorable if you want to see or take an average for their margins. So, or you can add the write-off value, and then you can get the right estimation, I'd say. So again, I've also compared the cost of equity and return on equity for Natco. So I've taken this. I've done the same thing that we used to do for our agrochem companies like PI or Punjab. So I've taken first is the cost of equity for 5 years, and then second is cost of equity of 10 years, and then case three is the average of cost of equity for 10 and 5 years. So if we see from FI 14 to 2023, FI23, their ROE has always been about all the three cases of the cost of equity. So we can say that the management has been able to deliver a good ROE to their shareholders historically. So yeah, this is where I'm going into the capex and R&D numbers. So capex, their main capacity expansion that they incurred was in FIs 18, 19, and 20. After that, they've not done much of capacity expansion as such. And even now, as of now, what they say, this is a snapshot from one of the latest con calls. So in the one person had asked them what investments are they planning to make. So we can see that Mr. Rajiv Nannapaneni, he says that no capex is required for them. They are at a very comfortable spot, and they have enough capacity for domestic and also for their US market, and they don't intend to develop more capacity. Rather, they want to invest more in R&D to enhance their pipeline, and because they also have extra cash, and also they want to do some acquisitions. But yeah, so not much capex is required here after, I'd say. It'll be only in this range. That is, they're expected to incur capex of rupees 250 to 300 crore per annum on maintenance capex, and maybe a little expansion going forward. So their main focus is R&D. So we can see that FY22, they were spending 12% of the sales in R&D. In FY23, they spent uh, 8%. That is because I think the revenue was sales was also much higher. But now they're planning to increase that again, and they're going to spend 10% of the sales compared to 8% in FY23 this year, since their cash flow is expected to be good. As per like the credit rating report that was released recently by I think CARE, so that mentioned that their cash flow is expected to be of more than 1,000 crores. So they'll be having a healthy cash flow as well. So an estimated 300 crore plus they'll be spending on R&D. That is more than the capex. So rather they'll be focused on spending more on R&D than capex, because capex is not something that they require. So pure comparison, this I want to say that it's not very accurate, because as we know, Natco's business model is very different and unique, or even from that matter, like very different from the other pharmaceutical companies. So I've taken Pure's, as in I've taken DV's laboratories, then Aurobindo Pharma, Ajanta Pharma, and Zydus Life Sciences. I've taken these companies because they are also into the complex generics formulation segment, and their major revenue also comes from the US. So I've not taken it on the basis of business model or something, because I'm pretty sure there's no company that follows the same business model as Natco. I tried to look for one, but no, I did not find one. So instead, I've just compared it with these companies that sell to the US, and their major like focus is on complex generics and formulations. So yeah, some of these companies are much bigger. So the comparison might not give us a any conclusive inference as such. But anyways, for the peer comparison, if we see Natco is on a higher side when we see the EBITDA percentage and PAT percent. Maybe because it is also a much smaller company, less currently. I mean, these figures are as of the latest quarters. So these are the quarterly figures. So as of the latest quarter, they did 927 crores of revenue. And Natco's ROE is at 15.7%, ROE is at 13.3%. So again, here also they are in a good space, I'd say. And debt to equity, they are a net debt-free company, and their ICR is, we can see it's at 113, very high. So debt is something that they need not worry about. So their financial health is pretty good. Price to book value, one small correction, I forgot to update this. It is more than 3x now. So Natco is at 3x and DVs is at 7.6x, and the rest of the companies you can see. So I mean, not very important this information, but yeah. So let's get to the growth triggers. So let's start with Revlimid. So Revlimid is a drug used for treatment of multiple myeloma, a form of cancer. It is among the top 5 selling drugs globally, with global sales of $10 billion in 2022. And then the drug is also under patent protection until 2027. It is owned by Celgene, which is part of BMS. BMS is Myers. I forgot the name of the company, but
Bristol
yeah,
Myers
sorry,
Squibb.
yeah, Bristol Myers. Celgene has settled patent litigations with 5 companies, including Natco, which will allow generic companies to basically enter the market, which already allowed the generic companies to enter the market in 2022 with volume limitations until 2025. So after that, there'll be no volume limitations in the last year of the patent, which is in 2026, post which the drug will go generic. So Natco was the first Para 4 applicant for this drug, and they had settled with the innovator, that is Celgene, in 2015. So under the terms of settlement, Celgene basically allowed Natco with their partner. Natco has a partner. Again, like we saw, Natco always has a marketing partner in the other country. So here their partner was a company called Teva. So they had a 33% profit share for Natco. So Natco's profit share was 33% after sales. So to sell the generic version of Revlimid from March 2022, basically. So the best scenario for Natco would be a situation wherein the market does not witness major pricing pressure, and thus with growing volume limits each year, Natco will be able to deliver continued strong growth till FY26 in Revlimid sales. And again, it is a large product, so they will be delivering strong growth year after year in the medium term at least. So Natco has only booked 25% of Revlimid in quarter 4 of FY23, until quarter 4 of FY23, since quarter 4 of FY22, and 75% is still left. So majority of the balance 75%, what the management says is it would come in the June, that is quarter 1 and quarter 2 of FY24. So the thing is, the market is still working with an assumption that Revlimid is yet like a one-off opportunity, and that Natco will not be able to generate or sustain the profits from Revlimid over the years, that is till 2025, say. So this, for us, we can take it as a short-term trigger also, that is, it could play out in quarter 1 of FY24 and quarter 2 of FY24. But if we go to see the bigger picture, I'd say the revenues from Revlimid are sustainable until 2025, and that this would be something like Tamiflu for the next 2-3 years for them. You will see exponential growth like we saw in FY23. The next thing is CTPR. So CTPR, or it is called a chlorantraniliprole. I'm sorry, my pronunciation is not very good, but so this is a technical ingredient. It is formulated into broad spectrum insecticides, which is used which is used across various crops for pest management. Basically, CTPR it provides an effective and long duration of insect control with its unique mode of action in crops like sugarcane, rice, soya bean, pulses, and vegetables by controlling all species and pests. So Natco, like I said, they're looking to be the first generic player for CTPR products, which are currently patented to FMC Corporation. It is a large American MNC. So, but now it is licensed to Syngenta. So Natco has already received approval for these products, and they were facing a lot of patent litigations, even with Syngenta, वगैरह. But now they have resolved all of it, and they have stocked large inventory for CTPR of around 110 crores. So again, this is also a short-term trigger. So their inventory is expected to be liquidated largely during quarter two of FY24. So this is also a large opportunity given that the end market for CTPR products is around 2000 crore rupees. And again, the same thing has also kind of happened with the CTPR opportunity. That is, the market is thinking of it as a one-off opportunity, wherein even after getting like a favorable outcome on the patent case, they are not fully discounting it, I'd say, only for the quarter one and quarter two of FY24. Then again, domestic business actually,
Shantanu,
yeah,
sorry, one question. CTPR opportunity for Natco is only for India market?
yeah,
Okay, so this doesn't have a global potential.
no, CTPR is only domestic.
Okay, okay.
Yeah. So domestic business again, this includes CTPR as well, but the domestic profits have kind of been suppressed and have seen a degrowth in the past 3 years. But what the management says that it will be stagnant from here on, and that no further downside is expected. So they have kind of bottomed out. Sorry. Yeah. So they have bottomed out. So they are expected to increase itself from here. So this is also again this is not a short term trigger. This would be a medium term trigger rather. Our Revlimid and CTPR would be the most short term near term triggers. And then they have the international and API business. So they are expecting the international subsidiaries and the API business to grow at a 20% CAGR for the next 2-3 years. So they are planning to launch 7-8 products in the Canada, Brazil, US subs as well, and they are now entering the Asian market as well. That is Singapore, Philippines as well. So there's no guidance about that, but they have given guidance for these subsidiaries in Canada, Brazil, US. So one more thing was again, like we saw, they have a negative net debt, and they also again they don't have long-term debt obligations also, and their intention is that they will be meeting their capex through cash accruals and internal cash accruals, and that they'll not be taking debt for any of their capex. So one key thing here is that they have a healthy financial profile. So even while all these other activities continue, that their business continues to grow, they don't face the risk of being under debt or something. So another medium term trigger we've already talked about is that whole key para 4 pipeline that I showed. I mean, I did not go through each and every one of it, but yeah, on the eighth slide, I had given that table. So Natco has a pipeline of 19 para 4 filings. 11 are already approved, and as on December 31, 2022. And in the medium term, they're looking to launch around 3 or 4 of them. Medium term, as in by 2031 or 2027, some of them. So these again, this is like you can think of it as like another Tamiflu, another Copaxone, or another Revlimid. So what we are seeing now will eventually occur then again, because if we see their past profile, they have always delivered, and they have a good history of successes, I'd say. And even another risks such companies face is I will be going to key risk, but I did not mention it there, so I'm mentioning it now. That another risk that they face is like say a Solara, Shilpa, Medicare, that they can come and they are always USFDA is very strict, and in these like recent years they've become even more stricter, and they're more stringent with their rules and regulations, and then they give them these form 483s vagera, and then eventually it could end up in an import alert or something, and it is more concerning for someone like Natco because majority of their revenues come from the USA. So but even in the past they have got around I forgot the number, but it's around 5 6 483 forms, and they had successfully passed the audits and regulations, and they had never come under something like an import alert or even a warning. So they have been very successful with that aspect of it as well. So that one concern is not there for this company. So the next two quarters are very important for Natco for our short-term triggers, I'd say, because it'll provide us more visibility on the sustainability of the Revlimid business and also the opportunity of the CTPR products. Now, key risks are that majority of their US formulation revenues come from their top eight products, that is Copaxone, Doxil, Tamiflu, Fosrenol, etc. So even in the domestic business, as of now, their major revenue comes 45% of the business comes from the top five products. So they kind of have like a product concentration risk here, but they're trying to diversify, expand, and they are also getting into agrochem. Very small part of it now, but well, they're doing things. So delay in US launches again, like I said, regulations, where everything is stringent, and there's also increased competition in Copaxone and even Revlimid now because Natco is not the only one who has come into a settlement with FMC. So meaning more entrants will be there in Revlimid space as well. So market is still like, again, one more thing was that market is still working with it as a one-off opportunity. So one thing that could happen is that if Revlimid does not, pull out the numbers that market expects it to, they might not rated positively. So again, Dr. Reddy, if we had seen their PAT, it had grown 100% year on year from in FY23 from FY22, but there was not much of a stock performance, I'd say, as you'd expected. I mean, there's a chance it could happen with Natco as well, but I don't think so because we have seen in the past, like 1 month, Natco is up 20%. In the past 6 months, I think around more than 15. Sorry, more than 50%. So, I mean, it is still a possibility, but yeah. Then, yeah, delay in approvals of para 4 products and then litigations, everything that is also one risk that they face. But with their past record, they're always able to deliver. And then higher inventory days and higher working capitals, as in they have a growing product portfolio. So they require higher level of inventory to be maintained. And then they are also focusing on markets like Brazil, Canada, Southeast Asia, China as well. So there, the receivables period is generally obviously higher than the domestic segment. So their working capital requirements will also remain high going forward. That is one risk. Yeah, thank you. If there's no question, I can go to the valuation.
Shantanu, one question. What is
Yeah.
their export to domestic revenue split?
Uh, this it's 50. No, it's not. It was domestic export to Can you repeat? Sorry.
So basically revenues में कितना % export से आता है, कितना domestic से?
Oh, okay. So more than 50% is from exports.
More than 50% is exports.
Yeah.
Okay. And this is as per like they reported quarterly, or this is
This
from
is as
annual
of FY22.
FY22
No,
annual?
but actually, I could show you the latest one also. In latest also, it is US formulations as also is the highest. So in that
Okay.
also, they had given like 1 second.
Yeah.
Yeah. So if you see here, they have one formulation exports karke. So that is
Okay.
where the major revenue is coming from. See, the total revenue is 926 crores for
Okay.
927 crores for
Okay.
this. So
Got it.
so for this quarter, major revenue came from exports itself.
Majority exports.
Yeah.
Okay. Okay. Got it.
Yes.
Okay. Thanks.
Any other questions, or I could go
No,
to the...
Shantanu, I think very good presentation. If you can give us some sense of valuations, I think.
Yeah, I will try to actually, because I kind of confused myself today while I was doing it because I saw something, but I'll get to it. Yeah.
Gaurav, any questions?
No question from my side. I'm still wrapping my head around it.
Okay. Right. Yeah, Shantanu.
Okay. So for valuations, I'll get to it later, but first I'll start with the basic thing that we do every time. So sales For sales, I've taken a 30% figure for the base case because what I think is Natco will be in the first 2 quarters, the Revlimid sales, 75% of the inventory is still left. So that will show up. And then also one small thing is the CTPR thing. I don't know how they'll kind of sustain the business in the future, but 110 crores worth of inventory is already waiting to be sold. And also their domestic formulations will uh, ramp ramp up, and revenue from their subsidiaries is also on the rise. So I've still taken 30% here, and that brings me to a sales figure of 3,519 crores for 2024. Now the material cost, I've taken FY23 um, as the base case, that is 24%, and best case being the minimum value, that is FY19, and worst case being the maximum value from the previous five quarters. So, yeah, sorry. Yeah. So then for gross margin, my gross margin comes to 76% after subtracting sales minus material cost. That is, if we see the gross margin, it has kind of fallen abhi in the quarter 4 figure is not out, but quarter 3 FY23 it was 71%. In quarter before that it was 77, 76, 83. But if like I said, quarter 1 and quarter 2 they'll see the Revlimid sales and of FY24, and also the CTPR thing in quarter 2 FY24. So I'm sure it'll be back to these levels here, or even earlier back, like last year it was 76%. That was when they only sold 25% of the inventory of Revlimid. So I've still taken 76%. It is likely going to be higher, I think. But for manufacturing cost, the manufacturing cost has never been more than 12% since FY19. So I've taken the base case as 10%. That is the average of the last 5 years. And the best case as the lowest amount, this minimum value, and worst case as the highest value. So for employee cost, what I've done is I've taken 70%, sorry, 17%. Um, so actually, if we see their quarter-on-quarter employee cost, it has been kind of high here because they had to pay off certain costs for the voluntary retirement scheme VRS, but that is done now and they'll not be incurring those costs. So that's why the average is kind of higher, 19%. But I think it'll be less, and not lesser than this because they still intend to spend more on R&D. So it'll remain in that level itself. So I've still taken 17%. And then other cost, what I've done is I've taken the average of the past 5 years again. So 21% it comes to. And the worst case, I've taken the highest value, and the best case, I've taken the lowest value. So the EBITDA percentage, so here's, yeah, so the EBITDA percentage in my case comes to around 28%. So yeah, then for depreciation, what I've done is, I've done the whole model thing of us. So I've taken 7% depreciation of the fixed asset value for 2024. It comes to around 188 crores. And yeah, finance cost I've calculated. Finance cost I've calculated through this interest model. First, I've taken CFO EBITDA, and I've taken the average and projected for FY24. And then EBITDA is from the valuation model itself. So the CFO I expect. So this is where I'm having problem actually, because the credit rating report actually said that they will have cash flows of more than 1,000 crores. But with the average that I'm
Shantanu, if I can just interrupt here,
yeah,
there's
yes,
no need to
please
make
do.
it so complicated because you said already that they have very low debt, right?
Yeah,
So you can just take the last quarter, what was the interest cost, and annualize it. Unless
okay.
you're seeing that in FY24 there's going to be a massive change in debt. Either the debt is going to completely get paid off, or they are going to take more debt. But they have said they are not doing a lot
No,
of capex, right?
no.
So they will probably maintain debt at same levels because they are also generating decent amount of cash flows. So if
Yeah.
debt is maintained at same levels, then last quarter's interest rate getting annualized is a fair assumption, right?
True.
So
Yeah, I think
around
that
10,
was
12,
better.
yeah, around 10, 12 crores of interest rate you can sort of assume.
Yeah, because mine came to 6 because I did something else, but I'm gonna
Fair enough.
try
No,
putting
I
12.
think 6 also makes sense if they are going to pay back
Why
their.
I taken 6 actually was because I was trying to come to a figure by seeing how much they repay. As
Yeah,
in
yeah,
FY23, they had to repay a large amount because in I think 22 they had taken another short-term debt. So
right.
in 230, they paid off 239 crores of that 470 crores, I think it was.
Hmm,
So then here ka figure I'm not taken because the situation was different back then.
right,
So I went to FY21 when they were not taking more debt, and instead they were like they had debt from previous 3 years or something.
right,
So here they had only paid 16% of the debt that year out of the cash flow. So
right.
that same figure, like what I did was I kind of wait, I kind of forgot now. So
It's
yeah,
okay,
so
it's
I
okay. So fair enough.
subtracted from CFO the
Yeah,
last year's debt, uska 16%. So as
okay,
in how much I'm assuming that they'll pay off. So from 166, the debt, if they pay off 16%, it'll go to 68 crores.
okay,
And which pay interest cost आता है 6
okay.
crores.
Fair enough. I think that's okay because I can clearly see that interest cost is going to be around 10 crores or less. So fine.
Hmm. So with that assumption, then tax I took 20%. There's no guidance, but I felt 25% might have been a little higher because their past was 20% and 17% last 2 years ka. Let
Hmm.
me
Last 2 years are 16% and 17%.
Yeah, 16% and 17%. So I've
Hmm.
taken
ठीक है.
20%.
Hmm.
And then, then market cap to sales, I took 5 year, 3 year, and 1 year ka median, and then
Hmm.
averaged it. And 6.1 it came to, but I thought 6.1 seems a little on the higher side. Market might not rate it that highly. So instead, I averaged the current median and the past medians. So I came to a figure of 5.2. That gives me a market cap of 5.2 multiplied by the sales
So, by
18,000.
the way, Shantanu, right now it's at 5.6x sales. Huh?
Oh, is it?
Yeah, it's at 5.6x.
Oh,
So I think 6.1 you can keep because I
and
think
then yeah, because then my triangulated figure might go off a
that's
little.
okay. That's okay. You don't have to force fit anything. I
No,
mean,
no.
let's see.
Okay,
So,
so if I take 6.1 also, it comes to the market cap goes to 20. Actually, this makes more sense because if Revlimid comes in, then their market cap will be more than 20,000 crores, is
hmm,
what I'd read on Value Picker itself.
hmm,
So yeah, so then the market comes to around 21,467 crores. The current market price comes to 1,173 rupees.
yeah,
That is 40% increase from the price it is at today. And then
yeah,
EV EBITDA, again, same approach. That is 5 year, 3 year, 1 year median. Average, I took off all the three medians. 18.5 it comes to. As
hmm,
per this, the the EV comes to 18,099. And the debt was, according to our interest model, 68 crores. And
hmm.
cash and cash equivalents, I've taken the same as last year, 546 crores. And with that, market cap comes to 18,578 crores. So the current market price comes to around 1,115 crores.
Right. Your EBITDA value is how much for the year? Your
So yeah,
projection?
978 crores.
978. Okay. Okay.
So actually,
Yeah.
one more thing I had to just show you,
Hmm.
which actually I saw in the morning and I was a little confused. So I saw this on Value Picker. Someone had posted a link to a thread. So on this one Surge Capital Research report thing,
Hmm.
in that I forgot his name, but he had done like a calculation.
Hmm.
So of how much like Revlimid has made. Like so in let me go one by one. So quarter four of FY22, the PAT was minus something, but because they did the write-offs, so it was minus 50 crores. They did write-offs of 278
The
crores. So if you
write-off was because of what?
COVID-19 ka inventory and also
Okay.
some provision for losses, which I'm not sure about, but I can
Okay.
get into it if you want.
Okay. Okay.
Uh, so yeah, so their normalized PAT comes to around 170, 171 crores. And in that, in that con call, what they had mentioned was their base business PAT is around 60 crores, 50, 60 crores. So with that, the profit share from Revlimid is one second. Yeah.
Yeah, this is this finance.
Yeah.
This.
So that I've just subtracted
Hmm.
171 minus 60 like them.
Hmm.
So
This is
111
this
crores.
is Q4 FY22, is it? डेढ़
Yeah,
साल
yeah.
पहले की कहानी. अच्छा.
Uh-huh. That is
Okay.
the thing is they sold it then, but then they held off the inventory.
Okay.
Then the initially what they were going to do is they were going to sell most of it in FY23 itself, but they didn't.
Hmm. Hmm.
So
ठीक
then
है.
estimated profit from Revlimid for the first year comes to around 370 crores.
ये
So
कैसे
and
हुआ ये समझ नहीं आया. ये 370 कैसे आया? 111 तक I am with you. After
okay,
that.
once yeah, that was divided by 30%. So okay,
I think it should be divided by 0.25 because you're saying,
yeah,
I think, yeah, the comment is
yeah,
saying that
because
it's, yeah.
I think it says 30%, but in the con call I read it was 25%.
Okay, it's fine. Okay, ठीक है.
So फिर भी it comes to annual PAT from base business based on their
60
what they
into
said.
4, yeah.
It
So
comes to
684. Hmm.
हाँ. So total करके 684 crores का PAT आता है इधर. But the same way what I was trying to do was kind of go backwards here. So now I'll
Hmm.
just change this figure.
तो
It was
684 तो डिलीवर कर दिया उन्होंने FY23 में. 715 डिलीवर कर दिया इनफैक्ट, राइट?
हाँ. Uh, yeah, 715 crores they delivered.
Yeah.
But that was again only with 25% of the inventory being sold of Revlimid.
Okay. Okay. Okay.
But and now this year FY24 they're planning to sell the 75%
तो ये 25-75 क्या है? मतलब ये एनुअल फिगर का 25% 75% ऐसा कुछ है क्या?
inventory का.
इन्वेंट्री का. अच्छा.
हाँ.
ओके. ओके.
So
गॉट
in that way, I was just trying to see if I take the same, like, I mean, it is not right to take the same assumption now because it is
इट.
from like 1 year ago.
Hmm.
But even if I do, so if I go backwards, what I did was I calculated EBITDA from PAT, ulta
ओके.
jaake. So here also see if I take the current average of the EV EBITDA median that I taken for the original valuation model,
या.
the EV comes to 19,148 crores. Market cap
Hmm.
comes to 19,625. The current market price again comes to 1,072.
Got it.
So around that range only it comes
I
to.
think the price to sales modeling is more comfortable, Shantanu, because I looked
Yeah.
at the various duration EV EBITDA medians. They've been very strong for Natco. So Natco price to sales has never. So for example, the price to sales median for the last 3 years, when last 5 years has been 5.8. Okay.
Yeah.
Last 3 years it has been like 8 because their sales have not done well. So last 5 years is, I think, a fair reflection. So it can be 6 easily. I don't think you're overestimating that in any way.
Okay. Okay.
So yeah, I think that should be fine because they bottomed out during COVID only at 4x. Yeah, they
Yeah.
never went below 4x. So
Hmm.
I think this is fine. I mean, 6x is not weird assumption. I think.
Yeah.
Yeah.
And
This
even
would.
theoretically, this figure makes more sense, I think so, because with Revlimid ka even annual profit that was with
Hmm.
25%, it was I think 444 crores what we got.
Hmm.
So if they are selling 75% this year, so it is
Hmm.
definitely going to be
Going to
more.
jump a lot.
Yeah.
Okay.
So actually, even my PAT figure should be more here.
तो FY22 में 25% बेचा है तो FY23 में कितना बेचा है?
No, that was दोनों का मिला के FY22 23.
अच्छा.
So
22-23.
FY22 में I think they only sold in quarter 4 जब
ओके.
लॉन्च हुआ था.
तो इन लोगों ने क्या FY22 से माल बना के रख दिया है और अब
हाँ.
बेच रहे हैं उसी माल को?
Yeah, that's what I've made out from their con calls because that's what they
ओके.
say. Like 2023 तक 25% ही बिका है. That is still quarter 4 of FY23. बाकी सब अभी रिफ्लेक्ट होगा.
ओके. ओके. गॉट इट. ठीक है. ठीक है यार, इसको मैं भी पढ़ता हूँ because it's so science heavy. Need to read a little bit on it.
Yeah.
But very good presentation, Shantanu. I think you also enjoyed analyzing it.
Yeah, this was actually one of my favorite ones to analyze.
Yeah, I can understand that from the presentation. It came through. I really enjoyed it. I think, I mean, this presentation is a good start for me to now reading, on my own. So thanks. Good job.
Thank you.
Yeah, good job. Really. Even I have to wrap my head around it. It's so complicated.
Yeah, true.
But
But
yeah, I
that
think.
middle portion where you explain all this para 1, para 2, para 3, para 4. That's very
Yeah,
nice.
that was very nicely done. Yeah.
Thank you.
Yeah.
Cool.
So last presentation, Shantanu.
Yeah,
Yeah.
unfortunately.
Yeah. No, that's okay. It's
No, no.
not unfortunate at all. So I think I would love to stay in touch. Try to
Oh, yes,
stay in
definitely.
touch.
Me too.
Yeah. And yeah, why are you not appearing for CAT? Yeah. Just curious.
I'll
Uh,
just stop
yeah,
recording.
Yeah.
sorry.
Yeah.